was an interesting adventure. The first surgical center in the United States was started in Phoenix, Arizona by a fellow who became a friend of mine, also an anesthesiologist, okay. Wally Reed. And we were the second, as far as we know, in the United States. Well, for my first 20 years, I was out in the sticks in Minnesota, practicing surgery mostly and general practice. And I knew that from that small place that there could be a lot of things done cheaper than the way I was seeing it done in a big hospital in St. Cloud. And for example, a D&C for a female, they would put them in the hospital the night before and do the procedure the next morning and keep them that day and send them home the next day, which is hugely expensive compared to what we used to do out in the sticks. We'd bring them in the same day, do the D&C, send them home. And that's an added cost, which most people didn't pay attention to, but I was used to thinking in those terms. So when I was in St. Cloud and I saw these, the D&C being done in the hospital, et cetera, I said, hey, we can do that cheaper and better. So
there was also another episode that some of the dental surgeons would bring in irascible children or difficult to control, and they kind of asked him if he could provide kind of an outpatient venue for that rather than taking them into the hospital. And so that was kind of another push that sent him in that direction.
I had the opportunity to use my ability and all my outpatient experience in this small place in Minnesota. So I just thought, well, we'll start it. And I found an old building in St.
Well, first of all, you rented that room in
that was
a building in downtown St. Cloud. And it was just one room, as I recall, in a small waiting room. And the ENT guys were down the hall, and so they began to bring the myringotomy patients to them, and we had them recover on mats on the floor. I mean, it was really
and the parents sat out in the hall on folding chairs, and we sent them as soon as they were awake and lively and able to be taken care of at home, we'd send them back to their home base with their parents.
Well, the surgical center, I think, has an opening of 72, and it was pretty clear pretty rapidly that we were outgrowing the one room.
Yeah, right.
And that's when Joe found the an old building that had was a printers building, and it was a wide open spaces.
All open in the back.
Yeah.
So there was roughly 3,000 square feet to work with. But when we started to do it, we decided we should have 3 little operating rooms back there. That's all it would handle, plus a recovery room. Well, there were no sinks in those rooms, so 2 of my children helped cut the concrete floor to put in a sewer drain from the sink and to bring and water supplies. So we laugh at that yet because the jackhammer, my son was about 17 and the daughter was about 12 or 13, and she thought she should be able to do anything he could do. So he says, okay, and he handed her the jackhammer. That was the end of her aspirations. I think we achieved that sometime later. I'm not sure exactly whereabouts in the period of time, but they knew all about us. But the first persons to license us was Metropolitan Life out in on the East Coast.
For
was
insurance.
Joe's
for insurance.
Yeah, it was for insurance purposes because we couldn't get in. We couldn't have a facility that was not understood to be a surgical unit. Mm-hmm. So Metropolitan Life had a guy by the name of Joe Clune.
It was an Irish name.
Joe Clune, I think it was. And he was the nicest guy. And he came out to visit us, looked it over one end and the other with a critical eye. And he says, looks to me like you're in great shape. And we're going to license you right now. This was Metropolitan Life, one of the bigger insurance companies, which made a big difference because before that, insurance companies would just laugh at us when we said we were an outpatient surgery. They would not pay the bill. Oh. But shortly after that, the state of Minnesota also decided that they would agree to that we were a full-fledged operating.
We had a state legislator from St. Cloud, and he really fought some battles for us in clearing the way for licensure and insurance and that type of thing. And one of our friends actually has become a friend within the last 5 years, told us that he was asked to sit on a board or something that reviewed outpatient facilities, and it was just so new. And he said they all looked at each other and wondered what they were going to do with this. And I mean, we had no idea this guy existed, but
I remember him saying that we don't know what this is, but if Joe Belshe is doing it, it's got to be okay. So, so anyhow, it worked out quite well.
One of the surgeons that used us brought in a poster that says, "A mighty oak was once a little nut that held its ground." And he put the poster up at the doctor's dressing room, and the little nut was Joseph Belshe.
Well, this lady to my right, we've been married for over 50 years, and we are celebrating our 50th wedding anniversary this last year. Well, it had grown a lot. Excuse me, the old building that we had it in was no longer, of course, adequate. So we formed a group and got enough guys and enough money to scare it up and build a new surgical center.
I don't remember if you ever practiced in the new building.
Well,
I guess you did.
I did.
You might have been.
My pictures in.
But it is really wonderful to know that the surgical center is thriving and still doing a service to the community.
It's always difficult when you start something which has never been done in most people's understanding. Mm-hmm. So we had that obstacle from the scratch, but that didn't make any difference because everybody starts from ground zero at one point in their life. So that was, I think, no question about it, the most difficult part of getting going was that nobody understood what we were doing. And the obstacles, as far as they were concerned, were not knowing. And I just have to trust that it was no more or no less capable than the existing systems. And if it was to save money, that's all. Everybody likes that idea, but they didn't know how it was going to do it. But we were able to show that we could really save money on. If you looked at every aspect of the healthcare system, it doesn't include just the doctors and the nurses and et cetera. There's all the ancillary individuals who really make it, the machine run, plus the fact that the population has to get used to the idea that they're going to take their little kid in one morning, going to have the procedure, and after they wake up, they're going to take them home, and the parents are going to be first on the line as post-op care. And I knew that parents are a lot more liable to being very good at taking care of kids because they're the ones who take care of them before we see them and after we leave them. So anyhow, I had a lot of faith in humans, in parents, and that hasn't changed. They still do a great job at manage those little children after we turn them loose.
You first had to really sell yourself to the surgeons, and they already knew him as a competent anesthesiologist. So from that respect, it was probably the surgeons that really had to kind of sell it to the, to families, to patients. People. Yes, right.
As a matter of fact, we were quite careful about not accepting on our staff anybody in the surgical units who were not high level, well tolerated, and well understood as being top of the line. And my wife has been a nurse for a long time.
And Jeanette came to us very early on. She was the scheduler at the hospital surgery. She probably was one of our biggest assets in the sense of her personality and enthusiasm, and a hard worker. She took maternity leave, and that's when we kind of ambushed her and asked her if she could work for us. And she brought her little boy at the time to work, and he, as a baby.
And he was in a crib, a little crib in her room.
Well,
I think it was a shoebox. Because I was not about to miss having Jeanette work with us if she would. So I found a shoebox and she put him in there, and he sat in her little cubicle that we called her office.
We had a wonderful group of people that worked for us. Just I don't think our operation could have been successful without the staff that we had. Jeanette was there for all of my tenure, and she was just Jeanette has become a good friend, but she was absolutely wonderful to be the person that rose to be the administrator. And so anyway, those are really fond memories of the friendships we've made and have.